Hello, everybody. My name is Marty Mascari. I'm with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center. The Aging and Disability Resource Center, or ADRC, is a project under the Area Agency on Aging, and both are under the umbrella of the North Central Texas Council of Governments. We are blessed once again to have Hollie Glover and Jamie Cobb Tinsley with the James L. West Center in Fort Worth. And today we're going to talk about managing hygiene in dementia care, toileting and bathing. And so before we get started, we're going to talk a little bit about the CEUs for those of you that are looking for CEUs. So I'll let you get started, Jamie, and then I'll cut in at on the last one.
Perfect. Thank you, Marty. Yes, we are very happy to offer CE credits for nurses, social workers, licensed counselors, and then if you want a certificate for attendance or completion of the program, you will receive a follow-up email from this program with a SurveyMonkey link. In that email, once you hit that SurveyMonkey link and complete the evaluation, it will take us probably 3 weeks to process all of those certificates, and then you'll receive your certificate by email. Just allow us about 3 weeks to do that. And the link and evaluation, they do close in about 7 days on August 3rd. So if you could do that evaluation between the time you get the follow-up email and August 3rd, that would be great.
And I have in the Zoom, all of a sudden I second guessed myself what I put in there, but I did put it in there. When you close out of Zoom today, you should pop up a Google survey for you to complete as well. That has to do with, that's for us, for our organization, and that has to do with our funding objectives that we set forth when we applied for the funding to do these webinars. And so if you could complete that as well, we'd certainly appreciate it. But please understand there's two different surveys. There's the Google survey that should pop up. Again, if it doesn't pop up, that will be included in the email, the follow-up email as well. But the SurveyMonkey is specific to CEUs. You do have to complete that if you want a certificate. But the Google survey is our survey, and we ask that you please complete that as well. So I'm going to turn it over to Jamie and let Jamie talk to us about managing hygiene and dementia in dementia care, toileting and bathing.
All right. Thank you, Marty. And yeah, this is I guess all topics are kind of tough when you talk about dementia care, but this one, we'll talk about hygiene, but we're going to really focus in on specifically toileting and dementia and how those individuals, their abilities are changing as the disease changes and how they're able to manage those self-care activities. Before we dive in, I just showed you this slide. That is actually a picture of the James L. West Center. If you're ever in Fort Worth, Texas, we would love for you to pop in and come take a tour and see us. We are a nonprofit here in Texas and really service persons impacted by dementia and what all that looks like. So those that are living with the disease, but their families and the community at large through education, care, and support. This is some information on me, but talking about our learning objectives, like I said, we will talk about how the disease is changing persons' abilities, really, and how those changes that are happening in the brain really are affecting what they are able to do as the disease progresses. We'll talk about how to set up the environment to where we really do promote success, but promote dignity and independence as well, so they can continue to do these self-care activities and manage their own personal hygiene for as long as possible. And then we're going to really dive deep into challenges that can come along with toileting and bathing, but best tips to help with those as well. To start off with, we have here the 5 senses and the 5 A's. And for us to understand what's changing inside of somebody with dementia, their brain changes that are happening that really affect or influence their abilities, it's important for us to know what is happening to those 5 senses and these 5 A's that are listed here: amnesia, aphasia, agnosia, apraxia, and anxiety. And to really understand that, I want y'all just to take like 20 seconds and just stop and figure out what all stimuli is going on around you right now. So just stop and take in everything that's going on around you, externally and internally. What are you seeing? What are you feeling? What's the temperature like? Are your clothes comfortable? Are you hungry? Are you full? Are you digesting lunch? What are you smelling? Maybe what are you tasting? What are you hearing? What's all the stimuli going on right now? And if we think about it, some of us more from others, there can be a lot of stimuli going on at any given time, but our brain, a healthy brain, is able to kind of filter out what it doesn't need to really focus on and focus on what it needs to focus on. So it can and make correct interpretations. So I can filter out all this extraneous stimuli that I don't necessarily need and focus on what I need to focus on. And a healthy brain is able to do that, and it does it continuously throughout the day. You know, you might have a lot of people in the hallway, for instance, talking, or you got a TV on in the background or whatever it is. And we may be hearing it, but our brain can filter it out and focus on what it needs to focus on. Somebody that doesn't have a healthy brain or that's living with dementia, they are having a hard time filtering out all the stimuli that's coming at them. And this is external and internal stimuli as well. So yes, it's what are they seeing, hearing, smelling, tasting, but also sometimes that internal stuff. Are their clothes comfortable? Is there a tag, poking at them? Are they hungry? Do they need to go to the restroom? Are their allergies acting up? You name it, all the stimuli, and the brain being able to filter out and essentially assign value to what it needs to assign value to. And that progressively gets harder and harder for somebody with dementia. And it's important for us to understand this as we're working with them in any type of situation, and approaching them and helping them with their self-care activities to help them figure out and make it a less stimuli or less stimulus environment for them to be successful. The 5 A's I mentioned. So we'll talk about these 5 A's and understand what they are and how they play a part into how somebody with dementia is interpreting and being able to navigate their world. And then we'll talk about the 5 senses. But I have anxiety here as that first A. Anxiety is our natural response to stress. It can be this fear or a feeling of fear or apprehension of what's about to come or what's going to happen next, or I don't know what's going to happen next. And if I don't know and I'm confused about what's going on, then my anxiety levels are already operating at a higher level. And I think we can all relate to when we have higher anxiety, that changes how we're able to function, right? And maybe even how we behave within our environment. Persons with dementia, I think, are operating at a higher level of anxiety. I know there's been some studies done that persons with dementia living in a community setting, in assisted living or a nursing home, their anxiety level is a little bit higher than a normal, your quote unquote normal rate. Just because of everything that's going on. So understanding that. So they have a higher anxiety. And then you have amnesia that's listed here. And I have these listed in order, like number 1, 2, 3, and 4, because this is typically how they might present, as they kind of layer on as the disease changes. And amnesia is a loss of memory. And this is not like what we might see in movies, right? But this is really somebody is losing that short-term memory, which is a common part of dementia, particularly Alzheimer's disease. And we know that over time, any type of dementia, that short-term memory will start to be affected. And then that memory will start to be affected into more longer-term memories. So it looks like they're regressing in time. So they may not remember what happened this morning or what happened yesterday, because they're kind of losing those memories or not able to record new information or hold on to that recent information, and regressing into time to where they may remember what happened 10 days ago or 10 years ago. They remember 10 years ago, and maybe 10 years ago, they weren't that 80-year-old woman that just moved into the community, but they were retiring from their lifelong career in the banking system, right? And they were going to go travel, and that's what they remember. And then you can see as the memories start to be more and more challenged, it can come into more of those procedural memories as they regress in time. And we all had to learn how to do our self-care activities. We all had to learn how to get dressed in the morning, right? And what order to put those clothes on. And we had to learn that. And that's a procedure that we do. We all had to learn how to brush our teeth and the order that we brush our teeth. So sometimes as dementia affects these certain types of memories, and particularly the procedural memories, I might start to be unlearning, if you will, the steps to doing one of those processes or those procedures. So I may not remember the steps of how to brush my teeth, so I might skip steps. Or I put my clothes on in the wrong order, or I have I come out and maybe my underwear is on over my pants. So I remember parts of it, it's just the steps are getting confused for me because of the changes that are happening in the brain. We see aphasia start to happen as well. And this is that inability to understand language, but also to comprehend the language that's being used, but also being able to use language as a form of communication. So their ability to use that language and understand language is changing, which is really going to affect how we help them with those self-care activities. Agnosia is a disorder that does happen where their inability to recognize objects or a sound, maybe a face, a shape or a smell. And it's not that they don't see something sitting there or they don't hear that sound. It's they're just not interpreting it correctly. They don't recognize it anymore. So they can hear the alarm going off or the phone ringing. They can hear that, but it may not be, they don't know what to do with that sound anymore. And we all had to learn what to do with those sounds. I had to learn what to do when the fire alarm went off. And I know when that fire alarm goes off, there's certain actions I need to take. And I'm prompted by that sound, right? So I'm not remembering that or recognizing what to do. I can see my fork sitting right there next to the plate. I can see it, but I may not recognize or understand what that object is anymore to do anything with it. So I might start eating with my hands. Or I might just confuse objects. The remote control and the telephone can be confused easily. So somebody might pick up that remote control and try to dial somebody with it because they look similar. Same thing with faces, taste as well. And this is agnosia. This is a thing that comes with dementia, just that inability to recognize objects. And then we see apraxia that can come in, and this is more in the later stages of the disease for a lot of people. But this is they're unable to carry out a wanted movement or a motor task. So this is the brain is not connecting with that muscle movement. Somebody might want to bend down to tie their shoes. They may know they want to, they may have the will to, it's just that brain is not communicating with that muscle movement at that moment. They might want to push themselves up out of that chair, but the brain has not connected with that muscle movement to do that. So it's a purposeful movement that is being affected in that moment, from that time. This does impact somebody's balance. It can impact their gait or their how they're walking, and it will start to affect all muscle movements, excuse me, including facial features. So you can see somebody in the later stages, they might have a flat effect, or they're not giving you a lot of facial cues. And this is because we have a lot of muscles in our face, and that brain, the changes that are happening may not be coordinating with the muscles in the face for them to use those facial expressions to communicate themselves as well. And I point these out and we talk about these because these are all going to affect how we care for somebody with dementia, but particularly as we're helping them with these self-care activities, toileting, bathing, brushing teeth, eating, getting dressed in the morning, different things like that. Because if I understand where their abilities are and where their inabilities are, I can coordinate or modify my care to match what their abilities are, as opposed to focusing on, well, they can't do this anymore. I know that their brain's not connecting with their muscles, or they don't even recognize objects anymore. So what's the point? Well, I may understand this, but how can I change my care to match where their abilities still are? And this is going to make more sense when we dive into toileting and bathing, but it's to understand that these things are happening. These are what's caused by the brain changes that are happening with somebody with dementia, and we can change our care to match with their abilities. So with the 5 senses, I mentioned, there's the 5 senses and the 5 A's. We just walked over those 5 kind of different disorders that can happen with dementia. But then the sensory changes that do happen with persons with dementia. And this is a short video that we'll watch, and then I'll highlight a few things in here. But this is really what's happening, the changes in the 5 senses in persons with dementia.
Hello. Today we're going to be taking a look at some sensory changes in dementia. When we think of dementia, we often just think of memory loss. And although this is a really big part of the disease, the damage to the brain that affects memory can also affect other things, including our senses. Now let's start by taking a look at changes to vision. To cope with poor processing capacity, the visual field narrows to reduce the amount of stimuli. This results in very limited peripheral vision. Another way the brain copes with limited processing capacity is by using monocular vision, so just using one eye. This affects depth perception, so it's not uncommon to see people with dementia failing to pick up objects or not quite reaching in the right place. Monocular vision also affects the way we process speed and movement. Even if approached at a normal pace, it can seem to a person with dementia that someone has just suddenly appeared in front of them. Another difficulty can occur over pattern recognition. Especially patterns involving lines or dots can be interpreted as moving, or interpreted wrongly, such as a circle pattern on the floor being confused for a hole. Dementia can also affect the way a person interprets sound. Damage to areas of the brain which process auditory information may limit a person's ability to understand long or fast-spoken sentences. People with dementia can also become hypersensitive to noise, meaning they can be easily startled by sudden or loud noises. They can also have difficulty filtering sound, resulting in noisy rooms becoming overwhelming. It could sound something like this.
I think it would be good to get dressed in a bit.
The next thing we're going to talk about is smell. People with dementia often suffer from olfactory hallucinations, smelling things which aren't there. The most commonly reported ones are burning rubber or toast. This can be distressing, giving a lack of orientation in a restricted environment. It is also common for things to start smelling different, less appealing or overwhelming, causing a change in appetite. Another thing that affects appetite is changes in taste. Loss of taste buds alters how people experience food and may result in people no longer liking the foods that they used to enjoy. Finally, it's important to think about changes in touch. Some areas of the body become hypersensitive, while other areas become hyposensitive. Typically, the mouth, palms of hands, soles of feet, and genitalia become hypersensitive, with people reporting greater tenderness in these regions. Even water from a shower can feel painful. Conversely, limbs become hyposensitive, with people reporting less sensation in these areas. This can increase the risk of injury, as people may hurt and even bruise themselves and not realise. So that was a brief overview of some of the sensory changes you can expect to see in people with dementia. Thanks for watching, and we hope you enjoyed it.
Okay, that was a really great overview on the 5 senses that do change. A couple of things I just want to dive down into a little bit more. She talked about the visual field and the visual changes that happen with somebody with dementia. And we know the visual field narrows quite a bit, even from the early stages all the way up to the later stages. And if you've heard Teepa Snow do some of her training, she talks about, the early stages, it's like they have on blinders. So their peripheral vision is cut off. They don't see people that are coming from the sides of them, but also kind of what's around them here. It's like they have blinders on, or they have a scuba mask over their face in the early stages. And I mean, I even encourage y'all where you're sitting, kind of put a scuba mask like over your face, and you can see, and what you do see and what you don't see. You still see quite a bit, but I don't see this whole, peripheral world around me, or it's very blurry. And that's important to know, is if I'm trying to navigate my environment or get somebody to be engaged in their environment, what are they actually seeing? As the disease progresses, it's like they're looking through binoculars, which does narrow that field of vision quite a bit. And in the late stages, it's like they're looking through a monocular or a monocle. So they're, where they are looking is very important. And everything else around that field of vision, they don't see that, or they're not engaging with it, or they don't recognize or know what to do with it. And that's important as we help them with self-care activities. Another thing, the busy patterns they talked about. What are the patterns that they're seeing? And it might be a busy pattern that can be overstimulating, but it can also be misinterpreted. An example I have is one lady moved into the West Center, and her daughters put together her room. It was a beautiful room. It looked so great. It was warm and inviting. All new bedding was on there, and the sheets they put on the bed had that chevron pattern. It was, that zigzag pattern, chevron. And the mom went to bed later that night, and she was able to verbalize there was snakes in her bed. So what she was seeing was not a chevron pattern, but what she saw, those zigzag lines were playing tricks on her. And it looked like snakes or possibly even worms in her bed. And that can be distressing, right? So those patterns can be confusing. Being aware of how busy is that pattern? What are they actually seeing with that? And then they talked about the noise, the auditory. One thing with dementia we know that the brain doesn't really affect is the actual hearing part. Now, there might be hearing changes just as a person gets older, but dementia doesn't really affect that part of the brain that is hearing. So us to talk louder is not as helpful because it's not a hearing issue from dementia. It's an articulation issue. Or are we using too many words? Or is the background noise affecting with what they're trying to hear? And again, they can't filter out the background noise to focus on what they really need to focus on. So being aware of how much noise is going on and what are they actually hearing. Even noise from a fan can, an overhead fan can really upset somebody, or it can really affect their ability to hear what's going on and understand what's going on. They talked about the smell, and they talked about their smell hallucinations that can happen. But one thing that we do know as well with smell is persons with dementia, again, there's some dangerous smells, or what we've assigned dangerous smells as, and what we need to do with them, that persons with dementia stop recognizing. So one of those is smoke. So they may smell smoke and they can smell it, but it kind of goes back to that agnosia. They don't recognize what to do with it. So there's not I smell smoke. You and I smell smoke. We know that we got to take some steps into action. We got to go figure out where that smoke's coming from, put it out, because we know what to do. We're prompted to do something. Person with dementia has lost that prompt or understanding of what that smell needs to do. Smoke is one of them. Chemicals, like cleaning chemicals, is another one. You smell bleach or pneumonia. We know we don't mix those together, but we also know that we need to get out or open a window when we have those strong smells. Somebody with dementia can smell that, but they're not associating it with the need to do something or recognizing what to do. The last two dangerous smells that they aren't recognizing anymore is body odor and urine and feces. So they might smell those, but again, they might smell body odor on themselves or somebody else, or they're smelling urine or feces, but they don't have that recognition, and I need to do something about it, or it's a dangerous smell. And of course, that's going to play into what we talk about here in a minute with toileting and bathing. And then the touch, they're hypersensitive or that hyposensitive. So they can be extremely sensitive to those areas they mentioned: the hands, the palms, the bottom of the feet, the face, the mouth area, and the genitalia area. Or again, not really feeling anything on the limbs or maybe even the torso of something. And of course, that will affect how we perform or help them with these self-care activities. And these self-care activities, the toileting, the bathing, putting our makeup on, brushing our teeth, feeding ourselves, these are just routine tasks we do every day. You and I do them really without thinking about it. They do take up part of our day and they're important, but they're not the most important, right? This is just something that we do and we move on to get on to the things we want to get to, part of our day, right? But it really is, it's our ability to do these self-care tasks or these ADLs, activities of daily living, is really a measurement of our functional status. And we're talking about functional status, and this has been studied and proven over and over that our functional status really does influence our quality of life for both the person that is losing their functional status and the person that's taking care of them. If you ever think about a time where maybe you've needed help, maybe you were recovering from a surgery or you were really sick or injured from something and you needed help with somebody helping you, whether it's taking a shower or going to the restroom or getting dressed, something like that. And you know this was just temporary and you're getting better, but that functional status, I mean, there's something to that, needing help for these things that you and I do every day without thinking about it, right? With dementia, there's the Maria Montessori approach to dementia care. But one thing she says is, everything you do for me, you take away from me. And with dementia, that is extremely poignant, because when we start doing for somebody with dementia, they will lose that ability much faster. I think, if I'm thinking about my mom, she might lose the ability one day, because I know the course of the disease, to feed herself without assistance, right? But if I start feeding her or doing more for her than and taking over what she can still do, she's going to lose that ability way faster. So even if it's taking her so much longer to continue to feed herself, and it might even be a little bit more messy, I need to continue to allow her to do everything that she can still do, so she can do it for as long as she possibly can. Because if I start doing for her, she's going to lose it way sooner. And that's an important thing, particularly as we're going to help with the number one purpose of helping with their ADLs is dignity and maintaining independence. We want to keep that as long as possible. And their steady decline when somebody with dementia, their ability to perform or capacity to perform their self-care activities really does start with a thinking challenge at first. And it could be anywhere from remembering to do it or skipping steps in that task or that procedure to do something, all the way up to where there will be physical challenges to them in those later stages of the disease, where physically they're having a challenge of just performing that task. And you see that decline, steady decline over the course of the disease. So setting them up for success, we do want to create an environment that is safe, friendly, familiar, and functional. So we want to make sure it's safe, that they're, that if they're in the kitchen, that it's a safe kitchen, so they're not going to accidentally turn on a burner and set something on fire, or even anywhere to, the mail is sorted and that the mail doesn't accidentally get thrown away and now bills aren't getting paid, or you've lost some important tax information or something, right? So the environment is safe for both the person and the caregiver. We want it to be a friendly environment, at a place that they want to be. Excuse me, and familiar, that there are plenty of things that that look like home to them, that these are things that, yes, this is mine and I belong here because this is a familiar place to me. And this might be putting up photos from their past, or having old props, or that old chair, even though that's a grungy old chair that has been in the corner and we've tried to get rid of that chair for years and years and years. But you know what? That's mom's chair and that makes her feel at home, and that's what it is. So I'm going to keep it out there. And then we want to make sure it's functional. So this is a environment where they can function and they know what to do in that environment. So when I walk into the kitchen, I know what to do. Or if I need to go get some silverware, I know where it is and what to do with it. It's functional and I can actually move around. There's plenty of space for me to move around. There's not too much clutter, and I am able to function in there independently as much as possible. Another thing to help them be successful is to continue and encourage physical and mental exercise. Because if we are keeping them physically exercised and fit, if you will, or engaged, and mentally engaged, It's going to work all areas of their brain, and all areas of their muscle groups. So small muscle groups, fine motor groups, but also large. They can reach up and grab something. So these large motor groups as well. So they can continue to perform their self-care activities. Because we're keeping them stimulated, and we're keeping those neuronal connections for as long as we possibly can. And then sticking to a routine. A routine is very important. And I would say even in the early stages of the disease, establishing a routine, and it's not being militant about the time, we're going to get up at 8 and we're doing breakfast and then we're going to brush our teeth, but we're doing the same activities around the same time every day. We get up, we have coffee, we do a little bit of exercise, we do some rest, we do lunch. It's the same routine every day. And there's a familiarity and there's a friendliness to a routine. And there's some functionality in there as well. And then using aids, incorporate aids, and I'll highlight some aids as we go along, just to help them continue their success and their independence. But I will say the number one goal is really with anything we do and working with anybody, but particularly doing self-care activities for persons with dementia is to promote that dignity and the independence. I think when we talk about challenges when it comes to toileting and bathing and other ways of hygiene, I think one of the biggest challenges is the lack of dignity and independence that comes with, now I need help with this. Or why is everybody in here trying to help me with these very private activities, right? And so if I come at it with, I am promoting dignity and independence, and this is a massive life change for both the caregiver and the care receiver as we're having to help with these self-care activities. So if I can come at it with, okay, independence and dignity is my number one goal in each situation, then that can help me with that. Mm-hmm. And we want to start with these 3 ways to help promote dignity and independence. And that's giving verbal instructions along with visual gestures, and then incorporating touch. So what I mean by that is verbal cues. The words, first of all, we want to make sure that there's not a lot of background noise. Let's set up the environment to where there isn't background noise. There's not a lot of stimulation that their brain's having to fight with. So it is, we're going to do this task and it's just you and me doing this one task, right? And then I want to have my verbal cues and visual cues kind of line up together. So any verbal instruction I give, I want it to be specific and concrete. And it's really one thought at a time. Because if I need Dad to take a shower, I won't come to him and say, hey, Dad, it's time for us to take our shower. Let's go ahead and get this done. You know how to do this. You've been doing this for a long time. I'll be in there to help you. Don't worry about it. But let's go ahead and go in there and do the shower. I'll go ahead and turn the water on if you want to grab the shampoo. And that's too much. It's specific. It's one thought at a time. It's getting Dad to the shower and let's turn the water on. Hey, Dad, let's turn that water on. Maybe that works, maybe it doesn't. Maybe it's I walk over there with him and show him the faucet and say, hey, hot or cold? And I'm doing it with him and I'm showing him. So I'm using my verbal cues or verbal instructions along with a visual cue, whether I'm doing it alongside him or I'm showing him or I'm asking him out. If I were to say, hey, we're going to go get washed up. This visual cue, persons with dementia are going to be able to process that visual cue while they're processing the verbal cue. And they may not ever get the verbal cue or the verbal words because the comprehension might be damaged more so, but they'll always be able to pick up those visual cues. So if we act it out, demonstrate that activity for them, do it in front of them so they can mirror us. They will always be able to get that more so than they will be able to maybe comprehend the words that we're using. We do want our words to line up and tell them what we're going to do before we do it or ask permission as we do it. But those visual cues are important. And then we incorporate the touch cues as we need it. We don't want to come in again, it's just start doing to them or doing for them. It's remember what abilities do they still have. I know Dad can still undress himself. He just needs help with maybe the order of how to do that. So I say, hey, Dad, we're going to take our shirt off. Yeah, you take your shirt off. And then maybe he can do that, or maybe you help him by touching his shirt or the shoulder of his thing. Hey, Dad, let's to get his attention, and then just kind of phone it in. That's my muscle. That's the major muscle movement I need to move, and then he can get his shirt off. Or we're going to start unzipping, or unbuttoning something. And then getting, if we need to use our hands to help them lead through an activity. And this is important, particularly maintaining that independence and dignity. If we are physically assisting, helping them with something, it's coming at an approach where they're involved in that physical activity instead of us just coming in there and doing for them, because Dad can't, get his, unzip his pants anymore or unbutton his shirt anymore. I just need to get in there and do it for him. Well, what if you do it with him? Whereas you grab his hand and y'all are both unbuttoning those buttons. So he's still a part of that activity all the way up to, the very end of his life. Even though you might be doing the actual physical work of it, he's a part of that activity. And that really maintains that dignity so much. And here's some more visual cue or help with this. So this is a care approach from Teepa Snow, whom I mentioned earlier. If you are not familiar with her, Google her. She's got a lot of great trainings and activities. But you can see here the picture on the left. Teepa is the one in the blue shirt. A few things I'm going to point out. So she is helping Amanda, and she is in her field of vision we talked about. So she is at level or even a little bit below. So you can see where Amanda, the woman in the pink shirt, is looking is where Teepa is, right? So she sees her, and she can see her facial expressions. She can see her shoulders. She looks relaxed. Her body language is very relaxed and kind of approachable. But then you see Teepa has her hand underneath Amanda's hand. So she's there in a very supportive stance or supportive approach. So they're holding her hand, and she can help Amanda do just about anything. Teepa may be using her fine motor skills, right? She's got her hand underneath there. So Teepa can be using her fingers to maybe unbutton her buttons or brush her hair, but she has Amanda's hand on top to where Amanda will always be involved in that activity. And you can see more what I mean on that middle picture to the right there, as a lady is helping somebody with either brushing her teeth or with her food, I don't know. But you can see there the caregiver has her hand underneath. The other lady has her hand on top. And the caregiver is actually doing the motions of putting the food to her mouth, right? But the care receiver is going through that same movement as if she would be feeding herself. She's going her muscles are going through that same movement. So she's a part of that self-care activity, as opposed to that caregiver just picking up the spoon and shoving it into her mouth. That's a huge to where that dignity and independence is. So I know it's a little hard to kind of explain online instead of showing you in person, but I hope these images help with that. And I encourage you to practice and really practice and just kind of hone your skills on how to do this. And it's called hand under hand. And you can Google that and YouTube some videos as well. But a couple of other things, our approach and our communication matters. Being respectful, remembering how the 5 senses are changing. And of course, those 4 A's, they see the object there, but they just don't know what to do with it. Things like that. Keeping the routine and the rituals, which I'll talk about a little bit more as well. And then participating together. So this is, our words do matter. Well, we want to use those verbal cues and telling them what we're going to do. Our words do matter. As opposed to, hey, we're doing this. I'm going to do this to you right now. You're going to help me with this. I'm doing this. It's time for. But it's more of a team approach. We're care partners. We're going to do this together. I need your help with. I'm so glad we're doing this together. Thank you so much for your help with this and your support. To make them feel needed and wanted and purposeful. And of course, being flexible and patient. So challenges with bathing specifically. So I mentioned this earlier. I think the biggest challenge with both bathing and toileting is that feeling of exposure and vulnerability. And there's an embarrassment, can be an embarrassment to this, because I don't need somebody to help me with this. Or I may not understand why you are in such a private activity with me right now. because I don't need this help, and this is so private, and I am so exposed and vulnerable. And I think that's where we might get some resistance to help or resistance to care if we're not approaching that correctly. Also, fear of falling or slipping. It can be scary in there. It's, they're unsteady on their feet. It can be, they may not be aware of where they're at and where they're supposed to be stepping, and it can be slippery. And if I'm fear of falling, then yeah, this is going to be scary, and I'm going to tense up and hold on and not let go and not let anybody help me with this. I mentioned earlier, it might be on another slide, but that hypersensitivity to their skin, that touch, right? Water, I think it mentioned in the video, water can be uncomfortable, like rainwater or shower water. It can actually feel like it hurts, or like there's little stinging my skin, and they may not see it. They're not seeing the water, and they may not recognize the sound of water coming out of the shower head, but they're just feeling all of a sudden maybe these little stings all over their body. And not only can that be painful, that can be very scary. Some memory loss can come like that. They don't remember that they haven't bathed, or they really think they already have bathed, and that is their reality. I've bathed, and I'm not going to bathe again, and you're not going to tell me that or make me do something I don't want to do. That sense of time, passing of time is pretty gone in the early stages for a lot of people. So it could be they're not aware that 3 or 4 days have passed and they haven't showered. It might, to them, they really did just shower that morning. A sense of rebellion, because they don't need people telling them what to do, particularly when it comes to their private activities. Depression can be there, just a lack of caring. But of course, depression can be managed and treated. And then that sense of being belonging, and that they need, that they're part of this community, or they're part of this family, or you need their help with this stuff. And it can be uncomfortable. What is the bathroom? What's the atmosphere in there? Is it cold? Is it kind of, drafty? Is it institutional looking? Is it not a place anybody wants to be? And confusion about what's being communicated. Not able to understand what we are asking them to do. Maybe we're approaching them too fast. Again, those external cues or signals they may not be recognizing, like just the feeling of being dirty or the body odor smell. They may not be recognizing that either. And no is a normal response to something we don't know or understand. No is one of those first words that we've ever learned. So that's the word's going to stay with us for a long, long time. And if I don't understand something, no is going to be one of my main response. Or if I don't know what you're asking me, or I'm scared, or I have some anxiety, I'm going to be like, no, 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 no. And again, also I mentioned this, they may not be able to see the water. They just feel a sting or a hard pressure on them. And then the sound of a fan or the sound of that running water can be upsetting, or they don't understand what that sound is. And it can be really, really loud, or sound like it's really, really loud. And that can be overstimulating to them. So they just don't want to be in the bathroom. So tips to help with this is make it simple, make it enjoyable, make the bathroom a place they want to go. So this is spa time. This is an inviting environment. There might be some aromatherapy going on. You might have some nice soft, instrumental music playing in the background. What do you have hanging on the walls? Is there too much stuff, or could you have like cute pictures of animals or something in the tub? I see those everywhere, and you can get them in there. Look at how cute this is and how much fun. Oh my gosh, smell this soap. Doesn't that smell so good? Feel how soft this washcloth is. Bubbles, anything to entice them in there and to keep them in there. You do want to make sure it's safe, of course. So, and you have everything ready. You don't want to get them in there and get this whole shower time started. And then you're like, oh no, I left the actual soap in the kitchen. I just brought some. Let me go out and get it. Or the towels are still in the dryer. Let me go grab them. Because then you might have lost them, or you certainly don't want to leave them there because it can be unsafe. If you are assisting them in the shower, you want to make sure that they're seated. So there's a shower bench, and having a handheld shower head that you can adjust or move up and down is going to be great for your legs and your back. So keeping that in mind too, and I'll show you a picture here in a second. And covering them up with a towel. This helps with that feelings of being exposed. And I would say warm towels, just put the towel over their shoulders so their top half is covered, and over their lap so they don't ever have to be exposed if they don't want to be. And you can either have them wash underneath the towels, or you can tell them, step by step what you're doing as you're going underneath and washing under those towels as well. So nobody's ever exposed, and it can keep them warm too. And recognizing those lifelong rituals, do they shower in the morning? Do they shower at night? Do they like baths over showers? Keeping those lifelong rituals and routines, those are important. Skincare is important too. For bathing and toileting, it is easier to prevent chapping and sores than it is to heal it. So we want to apply lotion often. So after a bath, let's apply that lotion all over and slather it on. That is so important and so much easier to take care of than having to actually heal something. Let them wear their glasses, let them wear their hearing aids, so they can actually see and hear when they're in there. Hearing aids, if you can't get them wet, but generally I think that's not really an issue anymore, but that's okay if they get wet. And then asking themselves, who's helping with that bath? Is a child helping a parent? Is it a son helping a mom, or vice versa? Really it's who would you want to help you or allow you to help you in the bath? And it might be that you need to hire somebody to come in and just help with shower time, or you ask, sis to come in and help with shower time for mom, because that's just going to be so much better for everybody. Because that could be a barrier for both people. And then a portable heater. So part of the environment is to make sure that it's warm in there. And this is, I think a lot of the times it's people don't want to take their clothes off for the shower. They don't want to do a shower because it's cold. It's cold and uninviting. So it might be that you turn the heat up, and you might have to be sweating for it to be warm in there for them. And we want to make that inviting for them. The thing about bathing is you only need a full hygienic bath 2 to 3 times a week, unless there's incontinence or sweating involved. If there's nothing like that involved, then really you just need a full bath 2 a week. It's not something you have to tackle every day. But there are other alternatives to bathing. So here, the image on the right, this is like a full hygienic bath in a package. You can go to CVS or Walgreens or wherever and buy those over the counter, and on there are step-by-step instructions. You get so many like 8 cloths in there. You stick it in the microwave so it's warm, and it tells you, cloth number 1 is for the right arm, cloth number 2 is for the left arm and shoulders, and then they're disposable, and it's a full hygienic bath then. But you can also do cleanup, kind of piecemeal, if you will, throughout the week. If you want to wash their hair in the sink, maybe that's something they're used to. Maybe they did that as a kid, so they can remember that. They have these shower caps as well that you can get at Walgreens or CVS, and just do a shower cap wash sitting in their chair or in bed. The no rinse shower caps. But you can also do a sink bath or a tub basin bath, or where you're just cleaning the private areas every day, and maybe their hands and their feet, so you're not having to do a full bath thing, and you're just kind of cleaning again parts of the body throughout the week, if that helps. Or if you really can't get them into the shower or into the bath. And engage them in the bath by using all of their 5 senses. I mentioned, smell this shampoo. Doesn't that smell great? Feel how, keep them engaged. How soft this terry cloth washcloth is. Isn't that wonderful? Feel how great this towels feel around you. Aren't those so warm? Keeping them engaged. Pat their skin dry instead of rubbing it dry with the towel, just to help with skin tears. And then, of course, the respect and dignity. And again, you can keep them covered the entire time so they're not feeling exposed. Here are some aids that I was talking about. That upper left-hand corner is a detached shower head. So you can keep it sectioned so the water's coming out where the faucet is. Sometimes it can be, depending on when they grew up or how they grew up, they might not have had a shower head way up at the top, but it all came out of the tub and the faucet. So if the water's coming out of the faucet, that's more normal to them, or what they would remember. Shower bench and transfer chair. If there's a tub lid, you have to step over so they can sit down first and then drag their legs over. The stair steps there in the lower left-hand corner, those are, I wouldn't say those are not best practice, because that can really fall on there unless you're helping them up those steps. I would prefer you use a shower bench and transfer chair. It's just way safer. And then, of course, the long-handed bath accessories. So they're able to wash their back or their hair. And especially if they're having some range of motion issues, this really helps with those. So with toileting quickly, you know, a lot of this we've kind of walked into. Again, I think it's the embarrassment, that feelings of exposure and being vulnerable. I don't need, why are you in the confusion of why are you helping me with this right now? I don't need your help, right? There can also be that fear of falling backwards into a hole. And I'll talk about this, but it might, you know, as we are helping somebody sit down, we're generally kind of pulling them backwards. And that feeling of being pulled backwards can be very off-putting and scary, because I don't know where I'm going to land. I can't see what I'm doing. And then you're pulling at me. And my balance is off, right? And my equilibrium is off. And that can just be, you know, I'm going to fall backwards into this thing that I don't understand or see. They can have a physical ailment, prostate problems, there's an infection, maybe they ate something that's just not sitting well with them, and then other problems with communicating their toileting needs. I would say with toileting, there will come a time where persons with dementia will become incontinent. It starts with urinary incontinence and then will become fecal incontinence. But I would say before that, there's a difference between being incontinent and having some accidents. And some of that has to do with that communication or being confused about their environment. You know, they have this urge to go, and maybe that urge to go, they didn't realize or recognize it until it was too late. Or they had the urge to go and they couldn't find the bathroom. Or they got to the bathroom and they didn't know exactly what to do when they got there. You know, there's a lot of steps to go into the bathroom. You got to find it. You got to understand, you got to use it. You got to find it, and you got to get your clothes off in time. You got to be able to sit down. You got to, you know, there's a lot of things involved in this. They can urinate in other areas of the house. They can use waste baskets, closets, planters, you know, because it looks like a hole. And maybe that's what they're remembering. They would just go into a hole when they were younger, or they're confused about where they are and they know they need to go, so they're going to go. Or they don't stay for long enough to have a bowel movement. So they're there, they might sit down for a minute, and then they're, you know, then they kind of get distracted and they're up and off, and then there's an accident that happens. Of course, mobility issues and that inability to control those bladder functions. When that happens, when, you know, whether it's an accident or you are having the beginnings of incontinence, we never want to scold or humiliate or just show the frustration. I would say most people know they've done something wrong. And that's why we can see sometimes they hide their soiled clothes, or they just wad them up into a ball over here and put them off to the thing. So they know something, they didn't do something quite right. So we want to make sure that their clothes are easy to take on and off. So when they do get to the bathroom, that barrier of having to unbuckle their belt and then their pants and unzip stuff and pull them down is not there, right? And we want to make sure they know where the bathroom is. And this can be where we label where the bathrooms are. We make sure the door's open so they can actually see the toilet. Again, it says visual cues to where we see them. We want to keep the lights on at night. So if they're, you get up to use the restroom, they can see, they go towards the light and they see the bathroom, and that can visually help them be more successful. Making sure we're using proper incontinence products, which we'll go over. And then there might be, let's keep a toileting routine. So about every 2 hours, it might be that I am respectfully asking them if they need to go to the restroom. I might take them to the restroom or show them, you know, we're going to walk by, oh, there's the tide. Do you need to use the restroom while we're here? Or I take to see and actually have them sit on the toilet to see, to really help prolong their independence or their dignity, you know, and prolong that possible incontinence and lessen those accidents if we're on that routine. And you can kind of train your bladder. We do want to know what their nonverbal signs are and watch for them. If we see that signal, then let's get them to the bathroom. Let's help them with that. What we don't want to do is decrease fluids. Dehydration can be common, and it can obviously be very dangerous, but there's a few things we can do. Don't give them, you know, I kind of cut out caffeine altogether, but we don't want to give them too much after dinner. So drink while you're in dinner. But after dinner, don't give them too much, and make sure that they go to the toilet before they go to bed, right? If you notice something new in their toileting behavior, if you have a journal that you're keeping there, this is something that you can help determine whether this is a change in their kind of dementia, or maybe there's an infection, or maybe they ate something, or there's a urinary tract infection. It kind of helps us maintain and kind of see where those changes are and what we need to do about them. If there is a mobility issue, use a portable commode to help them to still be able to use a commode, right? Or get to them, have them get to it faster. And helping them sit down on the toilet. This is, I think, a big thing earlier on. Again, sometimes we're helping somebody and we kind of pull them backwards and we say, sit down, sit down, sit down. Just, I got you. And we're kind of pulling them backwards. Well, that can be scary. If you ask somebody to do that for you, you're just kind of like, ooh, I don't like this at all. But if you have them stand, with their legs to the back of the toilet, you stand to the side of them and say, now bend your knees and lean forward. Lean your head forward and bend your knees, and your butt kind of goes back, and it's like you're going into a natural sitting position when you do that, so that afraid of falling into the hole is not going to be there, because I'm not pulling them backwards. They're bending their knees, you pull your head forward, and then they just kind of naturally sit down. If they're afraid of falling into a hole, you can put a towel over that, and as they start to sit down, you can pull it away from them, right? And then the same thing that we do in the bath. If there's that feelings of exposure or something, you can cover them with a towel. And you can ask them to clean themselves, or you can tell them step by step as you go underneath the towel to help clean them. You can try a different colored covers or commode seat if they're just kind of missing the toilet, or to help them see. It might be just, I need help to see where that toilet is, because if the toilet and the floor are around the same color, they may not be able to distinguish where to sit down. So if you have that covered seat on there, that can be very helpful. This is a good time to watch for urinary tract infections. If you see blood in their urine, or there's a smell, a really strong smell to it, or it might be cloudy. Of course, being clean and skincare is very important. So we want to make sure that those private areas are cleaned frequently. So it might be that I am doing some spot cleaning every day with some soap and water. And of course, that skin care is important. So we want to make sure that they're really dry, but that there's a lotion there as well. Particularly if they are in briefs or incontinent products, and they start to fidget a lot with their clothes or their briefs or something like that, it might be that those incontinence products aren't fitting them very well. So you might want to find the right fit. And here's a whole list of things. There's protective underwear, there's guards or drip pouches for men. You can do liners, there's underpads, there's adult wipes that we want to use. There's actual full briefs. You can use liners, pads, and briefs depending on the person and what the needs are at that time. But of course, what you will need is you use adult wipes and cloths. Of course, that's skin protectant and disposable gloves. And this is the same thing. You want to have everything ready. And I would encourage you just to kind of have a toileting cart in the bathroom. So and it's well stocked every time you're in there. You got your gloves, you got your briefs, you got your wipes, you got everything that you need. You got your creams, you got them right there. So you're not having to walk away and get something that you need. And just general safety, keep your phone within reach wherever you're at. In case there's a fall, you can call right there. Remove any locks you have on the doors to the bathroom just for extra safety measures. I would not have any rugs in the shower unless, or hang them up when it's not shower time. We don't want extra things in there that they could trip over or anything. Have grab bars installed in the shower and the toilet, professionally installed for safety measures. Of course, have a shower bench in there. You might even need to use a raised toilet seat to help them with mobility issues as well. And then just decluttering. We don't need extra stuff in there that's not needed. You have one shampoo bottle, one tube of toothpaste, right? We don't need everything in there. And then my last thing, I know we're a couple of minutes over, but take care of yourself and take breaks, because you have to have the patience, the energy, and the strength to help your loved one with these self-care activities, particularly if they're having a challenging time with those. So this is my information and Hollie's as well as the West Center. And again, information on our on how to get continuing education credits, and if there are any questions.
Well, I'm going to go over the CEU stuff real quick. Well, give people a chance, because I haven't seen any questions, and Hollie may have seen something, but I haven't seen any. But just so you know, for those of you that are on that are looking for CEUs, the Center for the James L. West Center is offering CEUs today for licensed nurses, social workers, licensed professional counselors in Texas, as well as certificates of attendance. You must have completed the entire webinar to qualify. You must complete the SurveyMonkey evaluation, which I will send out a link to in the follow-up email today. The SurveyMonkey email will be, the SurveyMonkey evaluation will be live for 7 days for you to complete it. At that point in time, it will be taken down, and then give them about 3 to 4 weeks to get the certificates out to you all. When you close out today, you'll also get a Google survey that should pop up. I realize some of you work for companies or have pop-up blockers on your computers, and they may not pop up. For most cases, I know that they do, because I get a lot of them right after. But I'll also send that link out in the email as well. Please complete that as well. The SurveyMonkey is directly related to CEUs. The Google is just our funding sources, so we can report back on our funding objectives that we set forth when we applied for our funding. I'm going to have you go to the next one, if we could, and put up the next topic is understanding Parkinson's and Lewy body dementia, how they affect the brain, and on August 9th. And so you're going to have a link to that to register as well in the follow-up email. But I just want that up there for you all to see. Hollie, did you see anything that came up while I was going over that?
The main thing was, is this presentation going to be available? How can they get the video?
Okay, so, and I'm a little bit behind because I was out of town last week, but we are putting up all of the videos on our YouTube channel, and you will get a link in a second follow-up email. Give me till the end of next week, and I should be caught up. You should have the link to this, but you can also subscribe to our email channel. I'm sorry, to our YouTube channel. It's at the bottom of the email. When you get the email, the follow-up email, you can go down there and subscribe to the YouTube channel, and you can see all of the previous webinars that we've recorded that are on there. But you will get that specific link in a week or so for today.
So Marty, if I will, I heard, or in the chat, somebody asked if there's ever presentations in Spanish. And I don't know if you or North Texas Area Agency on Aging does Spanish, but we did just recently hire a bilingual educator. So that might be something that Marty, you and we could talk about, maybe doing some programs in Spanish if there's a need.
We definitely could do that. I'll be honest with you, we've done some programs in Spanish. We don't get a lot of attendance for that, but we would be happy to put them on in Spanish and see what comes. So I think we should, shoot toward doing a couple and just see how it goes. And then if you all could help us spread the word, because my distribution list is people that have subscribed that are getting an English flyers from me. So if you can help us disseminate the information, that would be wonderful, because obviously it helps us if more and more people get on and participate.
Perfect. Wonderful.
The Catholic Church might support, I'm sorry.
It's a cultural outreach you will need.
Yeah. I actually have several contacts with some of the Catholic churches because we have done some Spanish before, and we've gone to, I know, ICC in Denton has a big Hispanic community, and we've reached out to several of them, and still we just don't get a lot of participation, just so you know. But we will definitely give it a try and see how it goes.
Perfect.
And show the percentage information again. Can you? Oh, you've got that, obviously. I think you've got everything, right?
I think so. I appreciate it. Sorry, I went a few minutes over, but
no, it's all right. It's just fine. Absolutely. And obviously a lot of people are still on, so they're interested, right? And so, but thank you all. Once again, Jamie and Hollie, thank you so very much. Incredible information, an incredible job. We certainly appreciate this partnership. Thank you all for joining us. Look out for the follow-up email and join us for the next one. Thank you all, and y'all have a great day.
thank you.
Bye-bye.